Welcome to the OMM Medicines module on psychotic disorders in under 5 minutes. We're going to use this flowchart to help you understand the similarities and differences between all the different psychotic disorders. And so the first place that we're going to start is with psychotic symptoms, or some of the presentation features that are going to be common for all of these conditions. And so for people who have any psychotic disorder, they're going to have some sort of combination of hallucinations, disorganized thoughts, and then delusions. So if you're posed with a question on a patient who has some or all of these symptoms, you know you're dealing with a psychotic disorder, and then you should go through the rest of the algorithm to figure out which one you're dealing with. Once we know the patient has a psychotic disorder based on their symptoms like those that we just spoke about, we need to classify it into the schizophrenia type psychotic disorders and the non-schizophrenia type psychotic disorders. And the way that you'll do this is by looking to see if they have a presentation consistent with schizophrenia. So do they have any of the negative signs and symptoms? Do they have tangential speech or circumferential speech? Or do they have any of the risk factors that would increase your thought that maybe they're actually having schizophrenia versus a non-schizophrenic disease? So if we decide that a patient does have a presentation consistent with a schizophrenia-like illness, we then need to ask ourselves, is there also a concurrent mania or depression that is also going on? And if they do not have any mania or depression, we need to look at the duration that these symptoms have been present for. So if these psychotic symptoms have been present for greater than 1 day but less than a month, that would be considered a brief psychotic disorder. If the patient has had psychotic symptoms anywhere between 1 and 6 months, then that would be considered Schizophreniform Disorder. And if the patient has had the psychotic symptoms for greater than 6 months and there have been multiple episodes, then this would be considered schizophrenia. Now, what happens if we said that the patient did have episodes of mania or depression with their psychotic symptoms? Well, we need to ask ourselves if there have been any episodes of psychosis alone, meaning that the mania and depression did not always occur with the psychosis. And if we said yes, then that would be considered schizoaffective disorder, or it would be considered mania or depression with psychotic features if all of the episodes in mania always occurred with the psychosis, meaning that there was never an episode of psychosis alone. They always occurred with the mania or depression. Now, if we have a patient who has a psychotic disorder and they are not having a schizophrenia-like illness, then we are really dealing with one of two conditions, and those are going to be postpartum psychosis or delusional disorder. And so if you are dealing with a mom who just had a baby, more likely with their first child, and they're having thoughts of harming themselves or the baby, then you're dealing with postpartum psychosis. The other condition is a delusional disorder, which shares less characteristics with the other psychotic disorders, but it's also considered a psychotic disorder. And in this condition, a patient shares a fixed delusion or a belief that is just simply not true. And there's a common phrase for when this happens between two closely related individuals, whether they're friends or family members, and that's called Folie, Deux. And so in this case, both individuals believe in a fixed, delusional, irrational belief. Schizophrenia is a very high-yield condition for your tests, and so you need to be familiar with a couple other high-yield points listed here. The first one is that there is going to be decreased dendritic branching or spines in schizophrenia. The second is that the positive symptoms are going to be the ones that respond to treatment, and the negative symptoms will typically persist even after treatment. There's going to be a relationship with schizophrenia and adolescent marijuana use, as well as living in urban areas. And then the cause of schizophrenia is believed to be due to an excess amount of dopamine. Now we'll finish with this slide on the treatment for these psychotic conditions. Almost all of them are going to be treated with antipsychotic medications, and these are your drugs like risperidone and aripiprazole. Now, depression with psychotic features is going to be treated with an antipsychotic and an antidepressant so that you have one drug to treat each component of their illness. And then postpartum psychosis is high yield to know because it requires hospitalization. So the first thing you do, even before giving them drugs, is hospitalize them because they are at very high risk of harming themselves or their child. And then you will give them an antipsychotic treatment. Now, if the antipsychotics don't work, you can use ECT to treat these patients. And that's the end of this video on psychotic disorders in under 5 minutes.